Almotriptan is an active substance in tablet form used to treat migraine headaches. It belongs to a class of medications known as selective serotonin receptor agonists, triptans. Almotriptan works by narrowing blood vessels in the brain, reducing the pain and other symptoms associated with migraines. Indications. Almotriptan tablets are prescribed for the acute treatment of moderate to severe migraine attacks, with or without aura. It is not intended for the preventive treatment of migraines or the treatment of other types of headaches. How to use. Almotriptan tablets are meant to be taken orally with a glass of water as soon as you feel the onset of a migraine headache. The dosage for adults is usually a single 12.5 mg tablet, but a doctor may adjust the dosage based on your response to treatment and the severity of your migraines. If your migraine symptoms improve after taking the initial dose and then return later, you may take a second tablet at least 2 hours after the first dose. Do not exceed 25 mg in a 24-hour period. It's important to note that almotriptan is most effective when taken at the early signs of a migraine attack. Contraindications. Don't take almotriptan tablets if you are allergic to almotriptan or any of the other ingredients in the tablets. You have a history of certain heart problems such as coronary artery disease, angina, heart attack, or uncontrolled high blood pressure. You have a history of certain types of strokes or transient ischemic attacks. You are taking medications known as monoamine oxidase inhibitors or have taken them within the past 2 weeks. Precautions. Inform a doctor about all the medications, vitamins, and herbal supplements you are taking before using almotriptan. Almotriptan is meant specifically for migraine attacks and should not be used for other types of headaches. If your headache does not improve after the initial dose, consult a doctor before taking the second dose. Keep track of your migraine attacks, including their frequency and severity, to discuss with your healthcare provider. Side effects. Common side effects of almotriptan may include but are not limited to nausea, dizziness, drowsiness, fatigue, tingling or numbness, flushing or warmth. Serious side effects are rare, but they may include chest pain or tiredness, irregular heartbeat, shortness of breath, severe stomach pain,